not every procedure is the right procedure for you. If you are going through this journey and you're experiencing this extra skin laxity, looseness, heaviness, and you feel like you look in the mirror and you just don't really see yourself anymore. But what I will tell you is that this is not the right procedure for you. Don't think just in the present. You need to think about your future. We need to come up with goals and plans and treatments that will be able to treat you for the years to come. If you are bothered by your neck and surgery is on your horizon or you're thinking about it, I have the solution for you. I have come up with Dr. Dunn's Neck Guide, your neck's best kept secret. My name is Brandon Dunn. I'm a double board certified facial plastic surgeon here in beautiful Newport Beach, California. And today we're going to be talking about the surgical treatments that I love to perform for your neck. And I want to help guide you through this process so you can understand which surgical procedure is the right treatment for you. It's confusing, I get it. And that's why I developed this guide to help use this resource so you can make an informed, educated decision. So let's first start out. You got to figure out what your concern is about your neck. So is it fullness? Is it heaviness? Is it looseness? Is it laxity? Is it the skin? Is it the deeper structures, the tissue underneath? You're probably not going to know the answer to that. So it's really hard for you as, a non-medical professional to know what exactly is that treatment. So what I will say is your age does help to determine ultimately what structure of the neck is causing this concern that you have. So patients frequently call my office because they see a specific result. And that makes sense. You see something online that you like and you say, hey, I want what they're having. And that's what all of us do, right? But the reality is they are not you. And so you have to understand what your anatomy is giving you and what is the best. So first and foremost, you need to see someone who's a professional to really be able to make sure what is the right treatment for you. So you need a consultation. That's first and foremost. This is your guide to make sure that you understand, is this treatment actually the right decision for you? I'm going to give you a couple scenarios so you can kind of understand what is in this guide. Probably the most common call that I get is I have a prospective patient that calls my office who's in her 50s or 60s. He or she is in her 50s or 60s, and they see an incredible chin liposuction result of the neck. And they say, I want that. And when you get a little bit more information about that, you see that the price is really good and you're like, the downtime is minimal, and you're like, this is fantastic. I want this. This sounds incredible. But what I will tell you is that this is not the right procedure for you. And the reason is because your anatomy is not suited for that treatment. It just doesn't add up. You're going to have more problems afterwards if you get that treatment, and things that we're going to have to deal with afterwards to try to correct. So that is what this guide ultimately helps you navigate, realizing that not every procedure is the right procedure for you. What your sister had, what your daughter had, what your mother had is not the right procedure for you. So use this guide as a resource to help guide you, begin to answer those questions, and help you set up yourself for success. So one of the other common calls that my office gets, or inquiries that I get from prospective patients, is excessive weight loss. And this is obviously a major trending topic. Ozempic, Wegovy, all of these medications, GLP-1s that help you ultimately lose weight, or even the good old-fashioned way of diet and exercise. All of these are very popular treatments in this day and age where people are losing significant amount of volume, weight, and developing skin laxity and wanting some help to be able to fix this. So if you are on this journey and you're experiencing extra laxity, looseness of your face, falling into your neck, then this is what this guide ultimately is here for you to understand as well. So if you are going through this journey and you're experiencing this extra skin laxity, looseness, heaviness, and you feel like you look in the mirror and you just don't really see yourself anymore, this guide was ultimately created for these concerns. This is obviously just a brochure and there's much more information on my website, but this is going to be able to help you navigate these decisions and make the right choice for you. So one of the other important topics that I always like to discuss, because so many of my patients come into my office and again, they see these quick, easy results with chin liposuction. And, obviously I've kind of pigeonholed myself in a way because I have such nice chin liposuction results and people are like, I want that. But the reality is that just does not fit for every single person. And it really just depends on your anatomy. And I know I talked about this for kind of older patients that call my office, but even younger patients that call my office. If you're in your late 30s or early 40s, so many people are like, no, I'm still young. I still feel like it's just fatty tissue under the skin. I can get that taken out with just liposuction. It's going to be fine. But the problem is what is happening is that your skin is aging at that point. And, maybe we haven't kept up with the maintenance portion, which we're talking about in the neck guide. Maybe we aren't doing some of the preventative things, which we're also talking about in the neck guide. And so, your skin quality is changing in your late 30s and early 40s. And liposuction is really a scary treatment that is not the right treatment for you. And sure, some people may be able to get away with it, and that's fine. But I don't want everyone to think that this is a one-trick pony. It's just not that. It's not that case. For my patients that are in their late 30s, early 40s, frequently the call will say, I want some liposuction. Give me the liposuction. I want quick, easy. It's cheaper. It's much less expensive. Obviously, there's no general anesthesia and other types of risk involved. But again, your long-term results are not going to be there for you. So this guide is your resource. This is obviously the brochure, but this guide is your resource to be able to give you the answers to those questions. Realizing that, if you're getting offered liposuction in your mid 40s, you are going to be seeing problems in the next couple of years. So don't think in the future, or don't think just in the present. You need to think about your future. We need to come up with goals and plans and treatments that will be able to treat you for the years to come. Like I said, this is a glimpse into the surgical chapter of Dr. Dunn's neck guide. There is so much more information in there. You need to check it out on our website. Leave comments. Let me know what you think about it. There's going to be a link in our description for you to be able to get the neck guide. Take some time, look it over, see if you have any other questions. Leave it in the comments, reach out to our office. I'd love to see you guys hopefully soon.